Chapter 19 Research Methods Applicable to the Medical Humanities. Aprit Darival Satinder Singh. Abstract. The application of the humanities in medical education should be evidence-based, relevant, and grounded in the local context. To collect the evidence, it is important to use humanities research methods which are a key part of medical education research. They help gain insight into personal and societal factors that could impact the illness experience. Qualitative research methods can contribute to our understanding of the human condition, a critical prerequisite to helping learners become reflective, empathetic practitioners of patient-centered medicine. In this chapter, we first distinguish health humanities research from health humanities as a teaching learning tool, and then we go over 5 humanities research methods in detail. Grounded theory, ethnography, phenomenology, narrative analysis, and discourse analysis. We conclude that the method depends upon the research question and on what is the focus of the study. Key words: anthropology, cultural, grounded theory, humanistic competencies, humanities, literature, narrative inquiry. Assess need. As biomedical researchers, we make use of mainly quantifiable data given the need for science to be objective. We are, as a result, conventionally trained to manipulate and measure well-defined variables and use statistical methods to support or refute our hypothesis. We frequently employ quantitative methods to measure changes in knowledge, attitudes, behavior, and skills, and in the long term, changes in patient outcomes after an educational intervention. Within medical education, however, sometimes we wish to explore the values and experiences of the human stakeholders. In addition, now that the phase 1 of the competency-based curriculum for undergraduate medical education requires sessions on the medical humanities, we will need over time to study the impact of the humanities on the acquisition of humanistic competencies in learners. Values, experiences, and humanistic competencies are not measurable in numerical terms, and we will be obligated to apply qualitative research methods. To put it succinctly, we use quantitative analysis when we need to measure things and qualitative analysis when we want to understand phenomena. Studies may and do use a mix of quantitative and qualitative research methods for a well-rounded study. For example, some of us are familiar with employing questionnaires to capture both numerical and non-numerical data. A book on research methods in medical education is incomplete without a discussion of those qualitative methods that are an integral part of humanities research. Use of such methods can contribute uniquely to improving our understanding of the human condition, a critical prerequisite to help learners become reflective, empathetic practitioners of patient-centered medicine. This chapter is about the specific qualitative research methods that are best geared towards capturing the humanistic attributes of stakeholders and the human socio-cultural factors contributing to the oppression due to illness. Brief. Humanities research methods are a key part of medical education research. They help gain an alternative insight and understanding of personal and societal factors that could impact the illness experience. The application of the humanities in medical education should be evidence-based. The evidence should be collected through research methods that are relevant and are grounded in the local context. Grounded theory, ethnography, phenomenology, narrative analysis, and discourse analysis are methods borrowed from the humanities, but which are important ways to create evidence for the teaching and assessment of the health humanities in medical education. Contextualize. The variety of ways in which qualitative data can be collected has been discussed in detail in preceding chapters. Suffice it to say that the data is primarily sourced from people and can be in the form of primary data or secondary data in the form of existing text, images, audio, or video recordings. The particular way to analyze the collected data will depend upon your research question. Let's take a look at the following scenario. You are in the middle of a devastating pandemic and along with your medical students, you are trying to make sense of the chaos that has ensued. Your broad goal is to uncover the perceptions of people about the delivery of healthcare during the COVID-19 pandemic. How would you proceed? Approach 1. One group of students plans to use pandemic-related writing published by medical journals in the preceding months. They will examine the writing for patterns that may help with a conceptual understanding of how people navigate the healthcare delivery system. The analysis will provide an insight into the problems related to the pandemic. Any theory generated as a result may help service planners find ways to improve healthcare delivery and prepare for future pandemics. This qualitative method is called grounded theory research as the outcomes are grounded in the data. Approach 2. Another group of students decide to visit a nearby leprosy colony repeatedly over a period of time and talk to residents about their experiences with healthcare during the pandemic. In response to lockdown and social distancing norms, and by maintaining COVID-appropriate behavior, they will conduct the visits in an open outdoor space. This will be an ethnographic method of research which is conducted in participants' natural setting. Approach 3. Yet another group decides to study events as they unfold in the intensive care units of their institution again by maintaining COVID-appropriate behavior. They choose to interview healthcare providers on site and take videos to capture perceptions of healthcare providers on the phenomenon of care delivery at point of care. This method is known as phenomenology. Approach 4. A fourth group of students wish to examine personal incident narratives of people who have experienced the COVID-19 illness directly themselves or in close family members. They will analyze the stories as a whole and look for patterns and clues that may point to the challenges faced by the narrators. This is the narrative inquiry method of qualitative research. Approach 5. The last group of students choose to examine political leaders' statements on the pandemic published in leading newspapers to determine how language is used to influence public opinion about the healthcare scenario in the country. This is discourse analysis. Figure 1. Terminology related to the scenario contextualized in this chapter. Describe. If the health humanities are about helping learners to reflect, to contextualize, to read between the lines, and to think critically so as to honestly engage with the patient's illness experience, or to gain perspective on the caregiver's or provider's experience, then the methods we use must capture these attributes. Health humanities teaching versus research. Health humanities research may need to be distinguished from health humanities as a teaching learning tool. When we use poetry in a classroom setting to introduce learners to the concept of empathy or of ethics, then poetry is a teaching tool or an intervention. At the end of the intervention, we could measure how many learners enjoyed the class and how the empathy scores changed after the intervention. Here, we have used a humanities tool in an interventional study and have gathered quantitative data. Though the tool is from the repertoire of the humanities, the research method is not. On the other hand, we could ask the class to do a close reading of a single poem or a collection. They would go on to record significant words or phrases and then consider the connotations and denotations of the words in the context of the poem so as to get a deeper understanding of how people communicate. Close reading with connotation and denotation is an important component of narrative analysis, which is a humanities research method. Here is another example when we use a piece of fiction or ask students to write a creative piece. Our goal would be to teach students to reflect and to critically analyze situations. That makes it a teaching method. However, when we examine the published literature for evidence of the human condition, and then we engage with the writing to understand how people experience illness in that specific context, then it is a humanities research method. qualitative research in the health humanities. Each of the approaches that we listed in the contextualized section can help uncover new information that we may not think of otherwise. Nothing in the data can be predefined. Qualitative researchers may be somewhat subjective, as they will tend to make observations and interpret them through the perspective of their own lenses. The information collected is based on participants' perspectives as interpreted by the researchers, hence is contextual and cannot be generalized to the larger population. Let us now examine each of these approaches in greater detail. A grounded theory. This method is often used in sociology when the goal is to examine textual data in order to generate theory. By generate theory is meant to generate a conceptual explanation of a process or an event when existing theories are unable to fully explain it. For example, if we consider the scenario we've given in the conceptualized section, we may, upon data analysis, theorize that writings by people with disabilities expose many unique barriers that are specifically pandemic related. Grounded theory examines textual data line by line and looks for features of interest in the writing, each snippet of which is then coded inductively. The hallmark of this method is that snippets are constantly compared with each other to look for patterns, and the coding continues until theoretical saturation is reached, which means that no new codes are being generated. Codes may be descriptive single words or short phrases that are reflective of the feelings, actions, or meanings implied by the narrator. The other hallmark of this method is that data analysis and data collection go on simultaneously rather than starting the analysis only after all the data is collected. This is helpful because sometimes early coding may throw up surprises and suggest that some areas need greater exploration, and so the questions asked of the participants. Text can be modified accordingly. Inductive and deductive coding. Coding is used in most methods of qualitative analysis and will therefore be described in some detail here. In inductive coding, the codes are generated live as we progress with close reading of the data. Being a thorough, iterative process, it is time-consuming, but it allows an unbiased examination of the entire data without any preconceived ideas restricting thought. Deductive coding, on the other hand, is used when we already have a set of predefined codes and we want to see how the data fits into those. Even during deductive coding, we should keep our options open and choose to assign inductive codes to text that seems to be important to the investigation, even if it doesn't fit into any of the deductive codes. Deductive codes may be gleaned from our previous work or could be based on a review of the literature. When we use inductive coding, conversely, the review of literature is advisably done after the coding to avoid bias and to see how our themes correlate with what others have said on the subject. We have often used both inductive and deductive coding to analyze the open-ended feedback from participants of our humanities workshops. For example, their reflective narratives were coded inductively, while their post-workshop reflections were examined for evidence of components of the ABCD paradigm. The reasoning behind us using an inductive approach for the narratives was that they were submitted before we met for the workshop, and it was impossible for us to know beforehand what they would reveal. The feedback, on the other hand, was obtained post-workshop, and we wish to examine if the workshop had been effective in introducing participants to the ABCDE attributes of physicians. A deductive approach ensured that our particular interest was captured through pre-decided codes. Once coding is done, the codes are re-examined and the ones that are focused and representative of the data are retained, while others are either merged or deleted. The focused codes are grouped together into a framework of categories that may be flat or have a hierarchical structure. flat framework of categories. Each code is given equal importance. This is simple to do when there are fewer codes, as in the example given above, where we used A, B, C, D, E as predetermined codes. However, for more complex analysis with multiple codes, a hierarchical structure may be more appropriate. Hierarchical framework of categories. A hierarchical structure allows us to organize the codes into themes of varying importance and also helps to show how they relate to each other. There may be many tiers. Figure 2, hierarchical framework of categories generated during inductive coding of qualitative data. The figure shows possible codes that may arise out of the task we set out in the beginning of this section. An examination of pandemic-related writing published by medical journals around issues of healthcare delivery. The example shows many codes, but you may need fewer depending on the objective of the study. You could merge logistics and economic if you find that there is too little data to support either one of them. Similarly, stigma and emotional mental health could be merged if needed. Some tips on coding. Find a balance between having too many codes and having only a handful. The code should not be so specific that it only applies to a few pieces of data, nor should it be so generic that every phrase fits into it. Avoid overlapping of codes. Each should be different enough from the other so as not to confuse the coder. Constantly compare codes and categories to ensure that they are accurate and representative of the data and don't overlap. The initial categories that we generate are tentative. The data is revisited to see if the categories are able to explain everything that is going on, and if the answer is yes, they are finalized and are interpreted to develop a theory that is grounded in the data. This is the most frequently used methodology in medical education and medical humanities research and has consequently been described in relatively greater detail. The ethnography. Ethnography involves the direct observation of people in their natural settings or contexts. It is frequently used in anthropology to examine the influence of social and cultural beliefs and practices on people's behavior. Researchers need to immerse themselves in the setting and to engage with the participants to understand the situation from the inside. In the example given above with respect to the residents of a leprosy colony, students could use an ethnographic approach to study how the pandemic has affected healthcare delivery to this vulnerable section of society and how their own beliefs and attitudes towards healthcare have helped them in these troubled times. The outcome of this research would be an ethnography. The ethnography could assist administrators and legislators in formulating policies that take into account socio-cultural factors that influence healthcare decisions and could help in planning for equitable healthcare delivery to all vulnerable populations. See phenomenology. Phenomenology originated in philosophy and is about exploring the lived experience of participants. The process focuses on individual experiences around a phenomenon of interest, which may be a routine one or an extraordinary one like a pandemic. Phenomenology involves seeing or thinking about phenomena in a manner that is open-minded, perception-based, and serendipitous. In our example, we are interested in learning about the impact of the pandemic on healthcare delivery from the intensivist perspective. Naturally, as is true for most humanities research, our own perspective is added on to that of the participant, and it is common to clarify in the final write-up in what way one's perspective may have influenced the results. An inductive analysis is conducted on the data in our example. It will be done to uncover emotional, psychological, ethical, and professional implications of the pandemic. The outcome of this study might help administrators understand what kind of logistical support and wellness resilience interventions are needed so that service delivery at point of critical care can be optimized. The narrative inquiry. This method of analysis is an examination of people's stories that directly relate to their experiences with real life events like migration, an epidemic, or stigmatization for a communicable disease. The origin of this method lies in literary criticism. Narrative analysis, unlike other methods of qualitative data analysis, takes the story as a whole instead of coding it in bits and pieces. Thus, attention is paid not only to what has happened but also to the context of when and where it takes place, who the other people involved in the story are, and how they relate to each other. The chronology may or may not be linear, as is usual when the narrator is engrossed with making sense of impactful events. Narratives usually do not display scientific objectivity, but are moving accounts of struggle with emotional impact that make them engaging methods in medical humanities research. Several narratives around the same event can be examined to see if any patterns emerge. The stages of narrative analysis. It starts with a close reading of the text and an initial tentative coding. This is followed by a deeper reading to interpret the narrative and look for complex truths that may have been left unsaid. The findings are then verified through a review of the literature, which also looks for alternative ways to explain or refute the findings. The final two steps are to write a representative account of whatever is learned and to illustrate the account and provide evidence through the use of quotes from the narratives. In the example we've chosen to work with, the personal incident narratives of people who have experienced illness due to COVID, the 19th of May uncover important alternative ways to improve access to healthcare that may not otherwise be obvious. For example, their stories may disclose that resident welfare associations or groups of philanthropic private citizens may be roped in early for logistical support should the need arise again. Discourse analysis. This research method, commonly employed in linguistic and cultural studies, examines written or spoken material in the context in which the discourse takes place. Through discourse analysis, researchers seek to understand how language is used in real-life situations. It focuses not so much on rules and syntax of language, but on the contextual meaning of the language used in the discourse. Attention is given to the purpose of the discourse, the assumptions and values communicated, and power equations between the speaker and the intended listener. The aim is to understand how language can expose social hierarchies and inequalities, or how it is used to achieve goals like trust building, conflict resolution, or rabble rousing, among other things. Entire conversations or texts are examined for how the narrative has been built from beginning to end, the presumed intentions behind the euphemisms or metaphors used, how emphasis was created, how pauses were used, and how engagement was created. The steps of a discourse analysis. Once the research question is defined, the source of the discourse is identified. In our example, the students plan to use political statements published in newspapers. The next step is to gather and record relevant facts like when was the material published, who was the author and who was the intended audience, and what was the social and political context at the time. This would be a good time to conduct a literature review on the topic so that you have a theoretical framework ready on which to base your analysis. Thus, if you want to study the language used by politicians when referring to the pandemic, you might want to read up on the history and nature of political discourse in the country in general, and on the history of the relationship between the political parties and healthcare service providers and users. The analysis of the content is the next step where, as mentioned in the other methods above, we look for themes and patterns consistent with our research question and explore the ideology, intentions, and attitudes conveyed by the wording and phrases used. The final step is to write out the results and to discuss it in the larger context while drawing conclusions that answer the research question. Picking an appropriate research method. It depends on what your focus is. Is it the phenomenon you are trying to understand? Is it the political discourse around the phenomenon? If it is the people impacted by the phenomenon, are you interested in learning of their experiences through observing them in their natural settings, or would you rather study narration of their first-hand experiences? Is your interest in examining data so that you can generate a theory? Summarize. As medical education researchers, we will need on occasion to examine the values and experiences of the people we interact with. In readiness for that, we must familiarize ourselves with qualitative research methods which are frequently used in the humanities. Which particular method we use depends on what question we plan to ask and on the nature of the material we plan to examine. Methods like grounded theory, ethnography, phenomenology, narrative inquiry, and discourse analysis have an important role to play as we seek to create evidence in the fields of medical education and medical humanities. Evaluate. Have you used any of these methods in your research? If not, which of them would lend itself best to answering a question about medical education or the medical humanities that has been troubling you? Road ahead. The best way to learn more about these research methods is to read the references at the end of the chapter and then to embark on the journey as soon as possible. Plan out a research project that uses one of these qualitative methods and share the results with the larger community of medical educators who might be looking for ways to integrate these methods into their work and could benefit from your experience.